Morning, I am Dr. Malik. Today we'll talk about diabetes because 2 days back, there was World Diabetes Day and we had a seminar on World Diabetes Day by diabetic specialists. Some doctors they were talking, some diabetic specialists they were talking on new diabetic medications and new types of insulins, etc. But half of the doctors they were only talking about reversing diabetes. How can you reverse your diabetes? How can you become a non-diabetic from diabetic? So I was a diabetic 3 to 4 years back. Now I am no more a diabetic. Not only now, within 3 months of starting the diet, changing the diet and doing some exercise. I was always telling you 80-20, that is 80% diet, 20% exercise. This is how you can reverse your diabetes, you can reverse your obesity, you can reverse most of your health problems. Most of your health problems can be reversed. So, your diabetes can be reversed, your overweight, that is obesity, can be reversed, hypertension can be reduced, that is your BP can be reduced. So we were talking mostly on that. So there are mainly two types of diet people usually adopt. Two types of diet. Number one, it is keto diet. Low carbohydrate diet, high fat, high protein. High protein in the sense protein should not be taken very high. It is limited 1 gram per kg per day. 1 gram per kg per day. If you are a 70 kg man or female, you must take only 70 grams of protein per day maximum. You should not take more than that. So 1 gram per kg per day. Whereas fat can be taken liberally and carbohydrates minimum. So this is called keto diet. It is a very important diet for reversing your diabetes. Yes, very important diet. Most of the people who are suggesting slow carb diet. That means the carbohydrates which you are eating should be releasing carbohydrates slowly. That means they must have plenty of fiber. The grain you are taking should be like this. That is completely fiber rich, and slowly fiber should come out and slowly release the carbohydrate. This is called slow carb diet, and it can be given by millets. You know there are 5 types of millets like kodo millet, foxtail millet, barnyard millet, brown top millet, and little millet. You know these are the 5 types: kodo millet, foxtail millet, barnyard millet, brown top millet, and little millet. These are the 5 types of millets which Dr. Khader Wali advises, which I am also taking for the last 3 to 4 years. I am just following Dr. Khader Wali's diet. So these are the 5 types of diet. So what should be your diet? At least 30 to 40% of your diet. 30 to 40% of your diet should be these millets. Rest of them vegetables. If you are a non-vegetarian, take non-veg liberally. Definitely there is no restriction on non-veg, and vegetables should be there in your diet. Vegetables is a must. Fresh vegetables are must. In fact, salads are very good. With fresh vegetables, salads, these are all very, very important in your diet. And there is no restriction on non-veg. And eggs. Non-veg eggs can be taken liberally. So this is the basic diet. So 30 to 40% should be your millets, and rest of it, 1 gram per kg per day is protein, and rest of it is fat. This is how you should take your diet. And why millets? Because they have got 9 to 12% of fiber in them, and the carbohydrate is released very slowly. So that, for example, you take your regular diet like rice, wheat. You are taking rice regularly, you are taking wheat regularly, you are taking maida regularly, you are taking sugar regularly, you are taking jaggery regularly. Jaggery from sugarcane. These 5 items should be strictly stopped. Stop them. No rice, no wheat, no sugar, no jaggery from sugarcane, and no maida. These 5 things should be stopped, because these are the 5 things which, after entering the mouth, after entering the gastrointestinal tract, within 15 to 20 minutes they are converted to glucose very very fast. So there is very high glucose, suddenly a glucose surge will be there, so that the insulin has to pump, the pancreas has to work like a hard laborer. It has to pump so much of insulin into the body, so that this insulin, this sugar which is there in your blood, makes the blood thicker. This glucose, sorry, the glucose which reaches the glucose surge after eating your rice, after eating your wheat or maida or sugar or jaggery, 15-20 minutes it takes for the glucose to come out. And once the glucose comes out, the blood is flooded with glucose. So what happens? What happens is the blood becomes thicker. The blood becomes thicker. So lots and lots of insulin has to be produced by pancreas to drive this blood glucose into the cells of liver, into the cells of other body structures like muscles, etc., tissues, etc. So high insulin, there is hyperinsulinemia because insulin is pumped out. Insulin is pumped out. Hyperinsulinemia, which leads to insulin resistance. Body becomes resistant to insulin over a period of time. And you need not have diabetes, but you are all pre-diabetics. Because you are having high insulin levels in the body, hyperinsulinemia and insulin resistance in the body, which ultimately causes all the problems of diabetes. You may become diabetic later, but all the diabetic changes in the body will occur, like heart blocks because the blood becomes thicker. With glucose. So naturally there are plaques here and there in the arteries, and ultimately leading to heart attacks, brain strokes, etc. So to prevent this, you have to stop those 5 things like wheat, rice, maida, sugar, and this jaggery from sugarcane. 5 things, stop it, and just start millet diet. Millet should be taken in whole. Millet grain should be taken like grain. Don't make them into powders and all. Initially for at least 6 months till you reverse your diabetes. Don't stop your medication also. Medication should go. Your diabetes medication should continue till the diabetes, you at least for 1 month, if your diabetic levels are very very normal, your sugar levels are, your HbA1c, everything returns to normal, then only slowly discontinue the drugs, but don't stop the drugs suddenly. So whatever the tablets you are taking, whatever medication you are taking, please continue till you have a normal sugar levels, normal HbA1c without medication. When you come to that stage, you can stop your medication, but don't stop sugar medication abruptly. Very dangerous. So this millet diet at least for 3 to 4 months or at least 6 months. Take the whole grain. You take the whole grain of millets as it is, like kodo millet, foxtail millet, barnyard millet, brown top millet, little millet. All these 5 types of millets, like Dr. Kadarwali says, they should be taken like whole grain. Don't make them powders, dosa, etc. No, at least for 5 to 6 months, don't do that. After that, you can do it. Once you achieve normal levels, you can do it, because the fiber should be released slowly from the grain and carbohydrate should be released. Fiber comes out slowly and releases carbohydrate. This is the technique. So it will be a slow carb diet. This you understood. Next, what should be taken? In oils you must take. Number 1 comes ghee. That too, if you have a very good ghee, home prepared is very good, or somebody is preparing at home and giving you, it is very good. So among the oils to be used, ghee is number 1. Number 2 is coconut. Number 3 is sesame oil, that is til oil, and number 4 is groundnut oil. This is village made oils. That is, this, they make with a bull. That there will be a old style village processing of oils. This should be taken. They are the oils to be taken. They are called as cold pressed oils. We call them cold pressed oils. They should be taken. Only cold pressed oils ghee, coconut, sesame oil, that is til oil, and groundnut oil. These four are liberally available, and they are homemade. They are homemade, and this cold pressed oils. All these should be coconut or til oil, that is sesame oil, or groundnut oil. They must be homemade oils, so that no contamination is there. Don't purchase in shops. And plastic bottles, avoid plastic bottles, avoid these. Please, number one, first avoid all packaged goods, all packaged items. Avoid pack. Number one in diabetes reversal, number one in diabetes reversal and obesity reversal is avoid packaged foods. Avoid packaged foods. Please don't eat anything which is packaged and which is labeled. Please try to avoid all those things. Everything should be homemade or village made, like the older ways. Right. Next comes no coffee, no tea. No coffee, no tea. Usually, coffee should be avoided. Milk and sugar is dangerous. And tea also, milk and sugar is dangerous. You can take black coffee just twice a day. Black coffee, in fact, without sugar, if you take it, it is helpful for liver, to reduce fat in the liver. Fatty liver can be reduced by just coffee. Two cups of coffee, one in the morning, one in the evening. 2 cups of coffee per day, black coffee without sugar per day, reduces to some extent. It reduces your fat in the liver. Liver fat can be reduced, and green tea can be taken, but without sugar. But this also, they say it is useful, but in general, coffee and sugar, tea, if you can avoid it, is better. Instead, you just take some lemon water, at least 2 lemons per day. 2 lemons per day with little salt. It is always good, because that the vitamin C which comes from them and the acids which are coming from it are very helpful for your biochemical processes in the blood, in your general body biochemical processes, biomedical processes. They are very, very useful. Dry fruits minimum. Please, you can take dry fruits very liberally, but they say that the way dry fruits are prepared is not that safe. They are using chemicals, etc. for preparing dry fruits. So you take smaller quantities, because the preparation is, dry fruit is not dangerous. The preparation is dangerous, they say. So try to take small quantities of dry fruits, restricted quantities. And fruits especially, you must think of their GI, that is, for example, you have how fast they are absorbed, how fast. See, first of all, any fruit, you calculate, you see in the internet what is its glycemic index, whatever fruits are to be taken, or if the glycemic index is very high, for example, pumpkin and some other like mango, their glycemic index is high. That means if you take them within 10 to 15 minutes, they release glucose into the body, just like sugar, just like your rice or wheat. That is dangerous. So try to take low glycemic index fruits, like guava, and apple. Apple is good. 35 is its glycemic index, and you can take guava, that is, it's only 15 or 17 is the glycemic index. Dry fruits have only 10 or 12 glycemic index. You can take, and always, whichever fruit you are eating, try to see the glycemic index of the fruit. If the glycemic index is very high, try to avoid that fruit. Take fruits which have got low glycemic index, like guava, apple, etc. So, for example, such fruits can be taken. Fruits should be taken, but low glycemic index fruits. And one more thing is proteins. In what way you take proteins? Proteins in the form of non-veg is good. Non-veg proteins is very, very good. So proteins from non-veg, and from vegetarian proteins, legumes can be taken liberally. All dals can be taken liberally. And soya bean is also a good protein, but they say that soya bean lot of chemical processing is going on with soybean, so try to avoid this chemical processing and all. So soybean to be restricted. So legumes take liberally, dals take liberally, but soybean, because of its chemical processing, you must reduce the quantity of soybean or better avoid. And regarding sugar and artificial sweeteners, no sugar, no sugar, no jaggery from sugarcane. Only thing is, please try to take, if you want sweet in the diet, if you have to use some sweet, try to use jaggery from palm tree, not from sugarcane. Jaggery which is made from palm tree can be used in small quantities, definitely, because that releases glucose slowly, not the sugar which comes from sugarcane. So definitely sugar and no artificial sweeteners, please. In the place of artificial sweeteners, try to take the jaggery which is coming from palm tree, please. And milk to be avoided. No milk, please. Milk is definitely not good. Milk for children below 6 months of age is good, but not human milk, that mother's milk. And later, it is better you don't give milk at all. Milk is damaging children and adults also, because nowadays our children are growing up. See, there is a faster growth. There are a lot of this poultry industry and milk industry, lots of chemicals and lots of hormones, and lots of steroids are being used. So as far as possible, try to avoid milk, but you can take dilute buttermilk, just 1 glass in the morning, 1 glass in the evening. Dilute buttermilk can be taken, or 1 cup curd per day can be taken, because it has got lots of bacteria in it, that is lactobacillus. You can take it. And see, cheese and butter and ghee can be taken. Cheese, butter, ghee can be taken, though they are milk products. They can be taken, but not the one which is available in outside stores and all. They are also contaminated. So always look for the best form of cheese, the best form of butter, the best form of ghee available, because most of the companies, they are adulterating the products. Be careful about that. Milk should be avoided. Milk to be avoided for your to be healthy, milk should be avoided. You can take cheese, butter, ghee from a good wherever there is no contamination. These are basic things, but the thing is, main thing, suppose what happens after millet diet, I just told you, because mainly the thing is, millets will reduce the glucose surge. Sudden release of glucose will not be there. There won't be any thickening of blood with glucose. The glucose will not be flooded into the circulation, so that there will be hyperinsulin production, over insulin production, and the pancreas is given lot of work. Pancreas should work like a white-collared man, not like a laborer. So pancreas should be given rest. If pancreas is given rest, thyroid will also have rest. Everything, most of the hormones in the body are in good form. Suppose you want to get checked. Suppose you are already, usually what are the tests you have to undergo? Means generally we say, okay, HbA1c, now and then you can undergo till the diabetes becomes normal. HbA1c monthly you can get it done, or you must have a glucometer with you to check frequently how is the sugar level till the diabetes is totally reversed. And one more test is how your kidneys are functioning. That is an important test. Serum creatinine is one more test you have to undergo. Serum creatinine test should be done occasionally. And triglycerides and cholesterol, serum lipids, serum cholesterol, triglyceride should be taken, but don't be very serious about triglycerides and cholesterol. Suppose if it is 250 or if suppose it should be 200, if it is 250, or don't be so, don't run after that. See, Just about 50 or 100 more is not a problem. Suppose it is double, for example, it should be 150, it is more than 300, then you should take some medication. Generally, try to avoid medications for cholesterol and triglycerides. Try to reduce only with exercise. With exercise, you can reduce cholesterol and triglycerides, and your HDL will rise. That is, high density lipoproteins will rise with cholesterol, and LDL will reduce with your exercise. Do exercise regularly. Exercise at least half an hour to 45 minutes per day. Walking is an important exercise. Cycling, walking or cycling. Cycling means cycling at home. Exercise cycle. One day walking or cycling. The other day you can do that dips and sit-ups. Dips and sit-ups. This is regular exercise. Dips and sit-ups. Upper body one day, lower body one day. Or if you have time, you do both. Okay. Upper body dips and sit-ups one day, and cycling or walking one day. Alternate days. Try to do that at least 30 minutes to 45 minutes per day is very, very important. This will bring your HDL up and LDL down. HDL is good cholesterol, people say that. So you can bring the HDL up, LDL down. Don't go for medications very frequently, very, particularly antibiotics. You don't take frequently. Antibiotics are very, very dangerous. Antibiotics should be taken if necessary, that too if compulsory only, because you have very important bacteria from mouth to anus, nearly about 12 to 13 feet of intestine. It has got very useful bacteria, very useful bacteria in the body. They work with you. They are the things which are producing lots of biochemical products which are useful to the body. So you must have healthy gut bacteria. Don't take antibiotics unnecessarily. Suppose you have some symptoms, you have any doubts that you may have chest pain, or you have a doubt, the only test I advise, generally I told you, sugar, BP should be checked now and then. Sugar can be checked at home. Even BP can be checked at home nowadays. You have all the machines. And serum creatinine is another test. Serum creatinine is a very good test how the kidneys are functioning. Serum creatinine is an important test. And lipids, that is cholesterol and triglycerides. And one more thing, very important is, ECG is not that important. ECG is only important when you have a chest pain or something like that. But you have a doubt, you have to undergo. There is one test called CT calcium score. CT means, that is CT scanning. CT calcium score, which tells you how much calcium is deposited in these three main blood vessels which supply the blood to the coronary vessels. They supply blood to the heart. So please, CT calcium score. They say CT calcium score. CT calcium score, you can get it done very cheap. It's not expensive. So that you will know how much of opacities are there. How many opacities are there in the coronary arteries. Are they dangerous? Is there any liability of getting chest pains, that is heart attacks, etc.? CT coronary angiogram, CT calcium score. If the CT calcium score is more, then you can go for a CT angiogram, not a routine angiogram. Routine angiogram is not necessary. CT angiogram is very, very useful. CT angiogram without any invasive, only small injection is given, and they do a CT angiogram to tell you how the three blood vessels are they clear or not. So if the calcium score is high, if the CT calcium score is high, then you can go for a CT angiogram. This is the test. One more test which I want to stress to clear your doubt is, this is a carotid artery, one here, left and right coronary arteries. Okay, sorry, carotid arteries, not coronary. Coronary arteries to the heart. Three coronary arteries, they supply to they are thin, 4 millimeter diameter. Here is a very big carotid artery. Here is a very big carotid artery which supply to the brain. So carotid artery in its beginning, it will supply the blood to the heart, and its end supplies to the brain. So you can undergo a Doppler test, carotid Doppler test, carotid Doppler, left carotid, right carotid, carotid Doppler test. They call it carotid Doppler test. So carotid Doppler test is a very small test, very cheap test, maybe 700 or 800 rupees, which shows any blocks are there in the carotid arteries. If the carotid arteries are having blocks, you can clearly say that even heart vessels, that is coronary blood vessels, also have got clots, and the brain also, the small vessels in the brains also have small opacities, not clots, opacities. Clots kadu opacities. So if we are undergoing a carotid Doppler test, you can clearly say in future, are you liable to get a heart attack or a brain stroke? Because if the carotid arteries are having opacities, small opaque opacities inside the arteries, then even in the brain they will have small vessels, and in the heart also they will have small opacities, which can lead to heart attacks. See, opacities are not the problem. See, once your gut bacteria, once your gut inflammation starts, you are not taking proper food, your gut goes into inflammation. Inflammation starts from your gut, from your intestine. Inflammation is body reaction, autoimmune processes. So inflammation starts from your gut. So once your food is good, no processed food and good home food, like what I am telling till now. So if you have this proper diet, there is no question of gut inflammation, which leads to other inflammatory problems in the body and various diseases, arthritis, heart attacks, etc. They are all because of inflammation which starts from the gut. Very, very important. Your intestinal gut is very important. Gut bacteria are very important. Try to maintain this balance. And this, so whenever in doubt, whenever you have a doubt, if you have a doubt, just once in a while, just once in a lifetime, get it done. If you are above 35, if you are above 40, you can get a this one, coronary calcium levels, that is just CT calcium levels, CT calcium score in the coronary vessels, followed by CT angiogram if necessary. If the calcium levels are high, if the CT calcium score is high, you are going to get a CT coronary angiogram. So CT angiogram, of course, CT coronary angiogram, or you can get a carotid Doppler. These are the things to be done if necessary only. Don't run after tests. Most important is your diet. Most important is you can reverse your diabetes. You can reverse your obesity. These are very, very, very simple. Try to do that.